COVID-19 has shaken up the world and shattered our delusion of public health safety. The pandemic has changed how we navigate through our daily lives and forced us to reconsider our own habits and expectations of the actions of those around us. As optometry adapts to these unprecedented times, the question remains, what will be the standard for our new normal?
The pandemic has made us reevaluate our sanitation standards. We've cracked down on literally everything as far as disinfection, and I think it really does help prevent the spread of the virus. And it'll also, if we keep these standards, will help us prevent the spread of anything that we haven't considered in the future. Our patients and providers have really been aware of their disinfection, their cleanliness, and their hygiene.
The public's expectations of healthcare will shift as we emerge from this pandemic. Patients will expect better protection from infection, better sanitation measures, faster exams, and remote healthcare.
Patients and providers are concerned about the safety of themselves and those around them. As we emerge from the pandemic, some patients may even expect that their providers have been vaccinated. On top of our traditional disinfection protocols, our standard of sanitation will be expanding to waiting areas and optical frames. Instead of us cleaning those maybe twice a day, we probably even double down to 4 times or 5 times a day.
Masks are not here to stay, as they lead to fogging a variety of commonly used equipment, such as our phoropters, condensing lenses, and eyeglasses. They also muffle our voices and make it harder to communicate with our hearing impaired patients. However, they will be socially acceptable to use for those patients who still desire the extra protection.
We've also had to improve our communication to show our patients how we're protecting them. So lots of practices are displaying signs and notices of sanitation and their safety protocols. Patients in the future may even expect this to feel reassured in the measures taken to guard their safety. Patients will value convenience and a reduction of in-person exam time. The demand for mobile check-ins, online patient history and triage forms, and text message alerts will force these technologies to become the standard of communication for all practices.
The world is quickly advancing further into the digital age in all aspects, including healthcare. New technologies provide convenient access to services at our fingertips, even in the most remote areas of the world.
Remote healthcare and telemedicine have become indispensable tools to keep us connected to our patients and integrate with other providers. Some companies have created amazing apps. These apps have helped them with checking into appointments, tracking orders of glasses and contacts, viewing recent prescriptions, and even accessing laboratory results.
We will have to embrace these new technologies because in some cases, remote care can be safer, more convenient, improve health outcomes, and allow us to provide care for those who would otherwise not have access.
I feel like the pandemic has forced us to embrace new technologies a lot quicker. It's been both easy and hard for students. We're pretty new to practicing, so new operations are easy to adapt to, but at the same time, we think to ourselves, by using this new technology, am I going to make the right diagnosis, or am I going to manage this patient right?
Student doctors are already being trained to manage healthcare remotely, and even younger generations may be more willing to implement this new way of practicing in their own careers. As healthcare providers, it is our responsibility to provide the best care possible. We can learn from the lessons of the COVID-19 pandemic and build upon these new standards to improve the lives of our patients.